Hi, my name is Kevin King. I'm actually the IMG Governing Council Chair, and I'm an emergency medicine physician.
Hi, I'm Tani Malhotra. I'm a maternal fetal medicine fellow in Cleveland, Ohio, and I am the chair of the resident fellow section of the AMA. I'm also an IMG, and I went to a Caribbean med school, American University of Antigua. So, Kevin, what do you consider are the best practices for coming to the United States to practice medicine?
That's a great question. Part of it is that the challenge is that depending on where we come from, depending on what our background is I think it's all about preparation. It's making sure we're prepared for the differences between the healthcare systems, understanding some of the differences that might be present in culture as we transition from wherever we work or train to the United States, and how do we actually prepare ourselves to be able to, avail ourselves of resources and to be able to be successful in that transition.
That's awesome. That was something I'd actually never thought about since I was from Canada. But what I have learned is preparing yourself kind of as your CV. Because a lot of programs, I feel like, in order to be able to come into the United States, you need to be able to get into residency. And in order to be able to get that, a lot of programs actually eliminate you based on your USMLE scores. So how well you do in school and the kind of letters of recommendation you have actually kind of set you apart in being able to get a good competitive spot in the United States.
And I agree with you. Part of the reason I said it varies is being a United States citizen but a foreign graduate is it also there's different things that everyone may face, but there are challenges in what we do. Our CV is important, everything. And I agree with you. Very good points. Oh, I have a question for you, Tani. What do you wish you had known before coming to the U.S.?
That was a tough question. Again, like I said, I'm from Canada, and I feel like the two countries are very similar. Alcohol is a lot cheaper in the United States. But I think just understanding the healthcare system, I came from a single payer system in Canada, and how healthcare was delivered was completely different from how it is here, and having to decide what medication somebody is going to get based on what insurance they have or what they'll be able to receive based on what insurance they have was something I'd never thought about having to think about. So that was something that I wish I'd known.
Mine is a bit more challenging because I am, as a U.S. citizen and coming outside the country and coming back, is one of the things I could say I wish I'd known is how different the healthcare systems are. I had an understanding of how things work in the United States from being a nurse's aide volunteer or different experiences. But when abroad, coming back, I didn't realize when I came back to train in the United States as a resident and as a fellow, is that I had to adjust the way what I was doing. The medications are different, the names are different. That's the thing I wish I had an idea before, because I might have spent a little time preparing for that so that transition was a little smoother and easier.
Oh, that's a very good point. Never thought about that. I think we always learned about the generic medications and never thought about like the differences between countries. So for you being a US citizen, but you just went to a school outside of the United States, what were the challenges you encountered and what would you do differently?
One of the biggest challenges, I think, is that going outside the country and coming back. The perception sometimes is that if we have not trained within the U.S. healthcare system, is that, how do we compete on the same level as a U.S. graduate? And I think that goes for all of us as IMGs. How do we successfully compete? And that's for any residency program, for any spot. So that challenge is, how can I show what I can do, how much I've learned, and be able to present myself as best as possible. And what I've done differently, I don't think there's anything I do differently. I think it's thanks to my experience abroad in combination with my training here it's made me the practitioner I am today. I only think I guess I got fortunate to where I went, that I'm very happy where I trained. I would only say that as long as a person is happy where they're going and they get the best training for them, then what's there to do different? It's about that best environment for the individual.
Well, that's awesome. I agree with all of what you just said. I think having to prove that you are worthy, that you are just as well educated and experienced as someone else who is trained in the United States as far as medical school was definitely a challenge. But I think I had the added challenge of the fact that I was on a visa. And so there have been a variety of challenges that I've faced, specifically have been revolving around where I even have the opportunity to apply for residency or fellowship, who would even consider sponsoring a visa. And then some of the other things that got a little bit more complicated surrounded the type of visa that I was on. And if I could do something differently is maybe I would have tried to advocate for myself a little bit more regarding the type of visa that I got. I'm on a J1 visa, which is a visitor training visa, which requires me to either go back to Canada for 2 years, which I don't mind, it's a great country, or I have to stay in the States and practice in an underserved area for 3 years, which again, I don't mind. And I would love to do, except that the spots are much more limited for people who are specialists. And so if I'd known that, I think I would have probably lobbied or advocated for myself a little bit more in trying to get a visa that would have been able to support me kind of going forward.
Good points on that. In the same tone this raises a question. Is it a good idea to choose a less competitive specialty for us potentially, along with our desired choices?
That's such a good question you bring up because the whole time that I was applying for residency, so I applied for OBGYN and then I applied for maternal fetal medicine and fellowship. And both times, everybody told me, like, you know, don't apply. It's OBGYN is a very competitive specialty. IMGs don't typically get into it, and you have a visa. But I knew that there was nothing else I wanted to do other than maternal fetal medicine. And so I kind of put all my all my eggs in one basket and went for it. And I know I wouldn't tell people to apply for something less competitive. If you've got your heart set on something, if you've worked hard for it, if you have the scores and the CV to back you up, no, go after your dream. Do you think differently?
No, I agree with you. As a residency program director, even looking at the graduates that I hire or the residents that actually I train, and looking at people in success when they graduate from the programs, and back to my own training when we're happy in what we do, then we're the most successful. It's always about having a backup plan for all of us. It's the smart thing to do, but it's about choosing what we love to do, because what we'll be happy with in 20 years time, 30 years time. It's important to make sure we choose that, but choose wisely so that we have a balance and have choices.
Yeah. Um, I know you were a program director for an emergency medicine program in Pennsylvania, but how has the AMA helped you become a leader within organized medicine?
That is actually very, very good question and very relevant. I'm more recent to the AMA and being involved in it. After I had done residency education, been a fellowship director before, and helped build some residency programs, is that I realized from my experiences with students, with residents, and with working with graduates and trainees, is that maybe I could utilize that information and utilize my experience to help others. And that's where I decided to go from my background as an IMG, an international medical graduate, to approach how can I join the AMA. And they've given me the ability to really work on specific items, be able to raise awareness, and collaborate with others to really advocate effectively and more effectively for what issues that we need to address, not only for our patients, for fellow graduates, and for other trainees.
I actually completely agree with you on the leverage, like meeting other people and leveraging your connections. I think that has been fabulous. I think just meeting other people from other spheres of medicine at the AMA, learning how they've tackled problems that commonly occur systemically or just in a specialty, and learning how they've been able to overcome that, how they've tackled hospital systems, how they've been able to come up with policies that have made effective change, and kind of learning all of that has really, I think, made me a better physician, a better advocate, both for patients and for physicians.
Do you think that there's any ways that, because of the opportunities we got, that we can leverage our IMG status and background to help us move medicine forward?
Absolutely. I think The greatest part about being a part of the AMA has been that I have this platform to bring the problems that we face to a very large group of physicians, to the largest group of physicians, the largest physician organization there is, and the loudest voice for physicians. So being able to bring to them an issue that we are facing that is specific to IMGs that nobody else may even know about or understand because they don't have the same experiences, and then being able to rally the forces, explaining the problem, and then actually being able to make that change has been so rewarding. And I'm sure you remember how we were able to get the letter about the H-1B visas and the resolution from last year about the H-1B visas. And I thought, that's it. That's how you leverage your IMG status and make change and move medicine for America.
And I agree with you. And the other part is that because we can use our experiences from other healthcare systems, as we have an aging in our population, we have certain issues that we're dealing with, whether it's medication costs, whether it's access to care. How do we be able to sustain those unsustainable costs if we grow them in the certain levels we're doing now in the United States? But we've all trained in different systems where we had to be more austere. We've had to use different resources and learn how to do that in a more constrained environment. We actually can bring in those ideas. And I think that's how we can help the AMA and help other organizations and help provide better care, because we can bring different ideas, bring different examples from other systems, and we can build the best one here with some of our input to guide and have inspiration.
Yeah. So how do you think the future composition of the US physician workforce will depend on IMGs?
I think it's going to be, even though there have been the growth in US medical schools, there's a larger number of US citizens who are going abroad and actually training in other programs outside the country, coming back to the United States. I think that there's still going to be a fair number of international medical graduates, and there are always going to be, from other countries who are not just US citizens, but who are other citizens from abroad coming to the United States to work, which is why your green card, or sorry, the visa issues are very important for us to keep on top of and be aware of. I think that we're going to play a part in the workforce because we fill a role. We fill a role in different areas, whether it's underserved or it's different catchment areas that we have difficulty finding physicians, and there is a shortage. And that's where many places are building more residency programs, and there's been more medical schools opened. So that's where we will help to fill that gap, but also fill the gap of need with qualified, competent physicians who will care well for the patients in the United States.
I agree. I also think the part that, and you mentioned this earlier in our conversation, is that the international medical graduates that finally make it into the system, that make it into the US medical systems, are really the top of the top. They're the ones who topped medical schools, the ones who did really well and were able to make it into the system. And these are some of the best physicians that we have at our disposal in the United States caring for the US population. In addition to that, I think IMGs have in much larger proportions tend to take care of more primary care patients in more underserved areas. And I think that even though we're, like you said, with the increasing number of medical schools, our need for physicians is not being met by the number of medical students that we're graduating every year. And we just cannot do without IMGs coming into the States.
Do you think there's any other value that IMGs bring to United States medicine besides filling in the void or need for practitioners?
Oh, absolutely. I think the population demographics of the United States is so diverse. I think IMGs really bring that diversity, the cultural diversity, the diversity of thought, the religious diversity, to be able to care and understand these patients that they're taking care of, and to be able to understand their value systems and be able to address them as such. I have a patient who is of Indian origin who had diabetes of pregnancy, and she met the dietitian 4 times trying to understand how to moderate her diet, and she couldn't because they don't understand what an Indian diet is. And it took someone who actually understands it to say, okay, well, cut out this or cut out that. And I think really IMGs bring that to be able to care for patients who are much more diverse and increasingly more diverse.
I agree with you. And I also found it's intriguing is that I've been able to bring some of the best practices of how to do exams, history taking, clinical diagnostics, how to do decision making, and apply the outside strategies that I've learned in where I trained in Ireland. There's 7 million people, where there's over 10 million people in New York City. So that's where we had to be able to practice within a certain amount of resources available. So a premium is placed on how we make our decisions, how we choose our tests, and why. And that's where bringing that stuff and combining with the US system, I've actually found that we can add that value. It's a value added component, because I'm already teaching this to students here, and I think other of us can do the same. And actually it can benefit our other practitioners or our colleagues, because they can learn from us just as we learn from them.
That's so wonderful. I think what's also really fabulous about all this is you and I are both categorized as IMGs. And if someone was to read about it on paper, there would be no difference between the two of us. And yet here we are, completely different. And like just in this dialogue, I think we've had different experiences, and we bring forth so many different points, even in this conversation, that I really wish that people understood the value of IMGs in the healthcare population and the healthcare services in the United States.
And thank you, Tani. And I just want to say also something we talked about earlier is how we leverage the IMG status and background to medicine forward. This is an example of how we can, because of our diverse experiences, because of our backgrounds, we have all of that. And with the working with the AMA, we can make a difference.
Yeah. Thanks so much for chatting with me, Kevin. Have a very nice evening.
Thank you, Tani. You too.
Take care. Bye.
Bye.